Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan. Polypill shows LDL-lowering advantage in high-risk primary prevention patients. Cardiovascular polypills are important, as I previously mentioned, as a fixed-dose combination of medications with proven benefits for the prevention of various diseases, particularly cardiovascular diseases, by combining different drug classes in a single pill to simultaneously target more than one risk factor. Now, whether the treatment with the CNIC polypill was at least non-inferior to the usual care in terms of low-density lipoprotein cholesterol and systolic blood pressure values in subjects at high or very high risk without a previous cardiovascular event. The switch from the conventional treatment to the CNIC polypill approach in patients who are at high cardiovascular risk without a previous event was considered safe and appears to be a reasonable strategy to control risk factors and thereby prevent cardiovascular diseases. Anterior lateral positioning of electrodes better for biphasic cardioversion of atrial fibrillation. Several randomized studies have reported different ways of treating atrial fibrillation. The previous studies have showed conflicting results regarding the optimal electrode position for cardioverting the atrial fibrillation. However, anterior-posterior electrode positioning is widely used as a gold standard and it is believed to be superior to the anterior lateral electrode positioning. According to a recent study that was published in the Circulation Journal, anterior lateral positioning is superior to the anterior posterior electrode positioning in biphasic cardioversion of atrial fibrillation. Thus, the authors concluded that the anterior lateral electrode positioning was more effective and the anterior posterior electrode positioning for biphasic cardioversion was not that effective. However, when these two were compared, there was no significant differences in any safety outcome. Atrial fibrillation after cardiac surgery tied to increased thromboembolic stroke risk. Atrial fibrillation and atrial flutter are the most common cardiac arrhythmias in both the general population and pre-operatively in cardiac surgery patients who have been admitted to the ICU. Now, the ICU environment, the subclinical variant, may have short episodes and fewer symptoms, and it can be even missed. A recent study reveals that the post-operative atrial fibrillation within 7 days following a cardiac surgery is tied to a 3-fold increased risk of thromboembolic stroke during hospital admission. The findings of the study that were published in the Journal of Cardiothoracic and Vascular Anesthesia Journal therefore suggest that speedy treatment of post-operative atrial fibrillation may definitely reduce the early stroke risk after a cardiac surgery. Post-operative atrial fibrillation within 7 days after cardiac surgery was associated with a 3-fold increased risk for a thromboembolic stroke during the hospital admission. Metformin use lowers the risk of neurodegenerative diseases in diabetes patients. Findings from a recent meta-analysis showed that metformin use, specifically long-term use, is tied to a lower risk of neurodegenerative diseases in diabetes patients. The systematic review as well as the meta-analysis found that the use of metformin, particularly when used for a longer period of time, is associated with a lower risk of neurodegenerative diseases. However, because of substantial heterogeneity among studies, there is still a need for high-quality randomized control trials to confirm this finding. That's all for today. I shall see you tomorrow.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.